Question 11. Vertebrae, general features, cervical vertebrae, thoracic vertebrae. Here you see the vertebral column. You have 7 cervical vertebrae, 12 thoracic, 5 lumbar. Then you have sacrum that are consist of 5 fused sacral vertebrae, and then coccyx that are consist of 4 fused coccygeal vertebrae. You have a cervical curvature, a thoracic curvature, and a lumbar curvature, and a sacral curvature. Now for the essential parts of each vertebra, you have a body, and you have an arch, vertebral foramen. And the vertebral foramen of several vertebrae constitutes the vertebral canal. Now the arch consists of pedicle and lamina. The pedicle has a superior and inferior vertebral notch, and these makes up the intervertebral foramen when you put together a superior and then inferior vertebral notch. And here the spinal nerve goes out through this intervertebral foramen. The processes of lamina is the spinous process, also called spine, the transverse process, and the articular processes. You have a superior, inferior, articular facet, process with articular facet. Then we have cervical and thoracic vertebrae. A typical cervical vertebra has a small body, a large triangular vertebral foramen, and it has a transverse foramen in the transverse process. This transmits the vertebral artery. See, the vertebral artery goes up through the transverse foramen of the 7 cervical vertebrae. Now the end of the spine is split, so it's called a bifid spine. And the transverse processes are also divided into anterior and posterior tubercles. Now the first cervical vertebrae is called atlas, and it has no body and no spine. Instead, it has an anterior arch, a posterior arch, and 2 lateral masses. Instead of spine, it has a tubercle. Posterior tubercle, anterior tubercle. This is superior view. And the anterior arch also has articular facet for dents of 2nd cervical vertebrae. The posterior arch has a groove for vertebral artery, and the lateral masses have superior and inferior articular facets. The superior are for the occipital bone of skull, and the inferior is for the 2nd cervical vertebra. The 2nd cervical vertebra is called axis or epistrophus. It has dens projecting upwards. This is anterior view, this is posterior view. The dens ends in apex of dens, and the dens is marked anteriorly by facet for anterior arch of atlas, and dorsally by groove for transverse ligament of atlas. You can see they lie on top of each other here, so the atlas would go around the dens so that the head can go from around its axis. And then you have the 7th cervical vertebra, called the vertebra prominens. It has a long spinous process which is not bifid, and the end of it is thickened and is palpable through the skin. And then for the thoracic vertebrae, they are intermediate in size between the cervical and lumbar vertebrae. On each side it bears articular facets for ribs. You have superior costal facet, inferior costal facet, and transverse costal facet on the transverse tubercle. Or the transverse process. And the vertebral foramen is oval, and spinous process is the rib going on this superior and inferior costal facet, and then a transverse facet. As you can see, also this is T6 and this is T12, so they get progressively larger the further down you go.